So one of the things that you've been, working on for a long time is this whole issue of equity and justice in medicine, medical care. I mean, among many other places. But you've just published a paper, I note. Got my exhibit A here, looking at, and the paper is called Improving Health Equity for Black Communities in the Face of Coronavirus Disease 2019. And I wonder if you could just sort of summarize either that paper or your perspective on what the issues are and then what can we do about them?
Yeah. So, one of the things that COVID-19 has unearthed is that there are differences in terms of underlying comorbidities, such as, and by that, what I mean are diseases that individuals have and different populations have. And so we've known for many years, as I mentioned, I've been writing about healthcare disparities since I was at the University of Maryland, which is, I won't date myself, but that was decades. That was decades ago.
That's okay.
And so now I think more people are focused on that and trying to understand why is it when you have a virus such as the coronavirus that we're dealing with, why is it that different communities, different populations are exposed to it and have a greater risk. And we know now that Black and Hispanic populations are dying at greater numbers than whites, for example. And when we begin to think about the underlying diseases and why is it that some races have a different proportion of diseases, we also need to talk about social determinants of health. And what that means is that the places where we live, where we receive our education, where we work, really does impact our health. And the stressors that comes along with those different environments, that impacts our health. And so there's now this renewed focus on that. And so one of the things that the paper really talks about is brings that to life, but also brings to life what we need to do in terms of what are some of the solutions for us if we want to improve equity, because it's really the health of one population, as we're seeing, really does impact all of us. And, just concretely by that, what I mean is if the health of Black populations is impacting with this virus and they work and they help, are on the front lines and you're exposed, then that means that your health might also be impacted. So it really does require that we all work on this together. And as I mentioned, it's not just health, it's also education, it's also environment. So there are many different sectors that are involved, and there's a lot of work for every sector to do.